Good afternoon, everyone, and welcome to the new IDF webinar. So today we're going to be speaking about the IDF School of Diabetes and DNEP. So we see that there are a few BCBs on the webinar today, as well as YLD. So we welcome all of you, and we're really happy that you're here to learn more about this IDF project. So I'm going to pass the floor to my colleague Shango now.
Thank you, Beatriz, for this invite and presenting about the IDF School of Diabetes. And thank you, everyone, for joining today's presentation. So before we get started, we can have a short presentation of ourselves. So in the education department, we are 3 people. We have Samir Patan. He is the education project coordinator since the last 5 years. He has a medical and public health background with expertise in medical education and project management, and he knows really well the YLD project. He has been part of the YLD committee, organizing committee and faculty between 2013 and 2015. Then we have Celia Burgas, our newly joined colleague that sits by my side today. Hello, Celia.
Hi. Hello, everyone, and welcome to this webinar. My name is Celia. I am a nutritionist, and I'm specialized in genetics and public health. And now I'm working together with Sango and Samir in the education team.
And thank you, Celia. And finally, here I am. My name is Sango Bimon. So I joined IDF in 2018, and I worked in the advocacy team. And then I'm working now in the education department. And I have a background in fundamental rights at international and European level. So if you have any questions, we invite you to write it down in the chat window, and we'll try to respond to all of them at the end of the webinar. So if you're comfortable, and without further ado, then let's get started. So you've probably heard millions of times this expression, prevention is better than cure. And I have to say that this is exactly what we strive to promote within IDF and in all parts of the world, whether it is through advocacy initiatives and education activities. Currently, we have 415 million people with diabetes around the world. And the situation may get even worse if nothing is done. If we take the latest figures, for example, it is expected that in 2040, 642 million people will get affected by this condition. So this is terrifying figures. And to give you an idea, it's equivalent to twice as many inhabitants in the United States, or even both Central America and South America combined. And education is one of the most powerful tools to make things change and prevent these scenarios to happen. And education is also the easiest way we know that can promote healthy and enough knowledge to professionals in that field. And as a YLD member, you're also part and participating actively in reducing those gaps and reducing the angle of the arrow that you're seeing on the screen right now. So the grownness need to educate healthcare professionals on diabetes started some 20 years ago when IDF developed in 1994 some international standards for healthcare professionals in the field of diabetes. So the documentation got better and better year after year with experts, researchers, and scientific outcomes until November 2016 and the launch of a revolutionary tool called the IDF School of Diabetes. And since that date, we strive to propose more and more content to all the people affected by diabetes, and also those who take care of them on a daily basis, the healthcare professionals. So you can see on the screen some key dates about since the release of the school. So it includes basically all the recent developments of our courses that we'll talk later on, and also all the progress to make them as accessible as possible. So you're certainly wondering, what do we do in practice? So we cover 4 main points. The first one is that we share evidence-based education. So our experts have put together some incredibly high-level and evidence-based content on diabetes, and we put them in the form of modules and courses. Second, we propose content available for all. So all the courses that we propose in the school are for different healthcare professionals, besides different professions, and we cover a wide range of topics. And we try that for each courses, they are translated in different languages so that we can so that more people can benefit from it. Thirdly, we develop interactive tools. So all the content available and all the courses are accessible from different devices, that is, computer, phones, tablets, and we wanted all of them to come with voiceover so our learners can experience more exciting training. And last but not least, we analyze data to improve our users' experience. So we care about our feedbacks, the feedbacks of our learners, and this helps us tremendously to improve our content, to create new resources, and that also helps us to draft articles that will then be published in medical journal. So this is how the homepage of the school looks like, and this is where the journey of our users begins. So it's really important to understand that education, diabetes education, is what will ensure that diabetes management is properly respected. And this is why we have multilingual courses online for healthcare professionals so they can develop and enhance their knowledge and their skills. This will help them to manage effectively and to treat their patients with type 2 diabetes, and also manage those at risk. So diabetes education is really, really important. And this is the platform in which you will find all the courses that we propose. And I insist on the fact that effective management, for an effective management, you need to be informed about nutrition, about exercise, about regular checkups, about monitoring, and this will help you to prevent diabetes, to also manage all the crisis period, to take care of your diabetes on your own, and also to make the appropriate lifestyle changes required. And I'm not the one saying that. This is advocated by the International Society for Pediatric and Adolescent Diabetes. So this comes down to our certified online courses. There we have. So why certified? So they're certified because they have been accredited by the European Accreditation Council for Continuing Medical Education. So once you complete the course, you will have a certain number of European credits, and you will be awarded with an IDF certificate. So this is high-level content that has been put together by world-leading specialists in that field. It has been reviewed by renowned experts, and always to make sure that learners can benefit from the latest content, updated content on diabetes, on its management, and on its prevention. So in sum, 3 certified courses. So those are 3 paid courses. So we have primary care physicians and general practitioners. Then we have a diabetes educators course, and then a specialist course. So primary care physician, as the title suggests, if you're a primary care physician, a general practitioner, a family physician, or any medical profession involved in management of diabetes and care. Diabetes educators, if you are a nurse practitioner, a nurse professional, a physiotherapist, and so on and so on. And specialists, it's all about ophthalmologists, cardiologists, but we have neurologists, and all of that. Yeah, a lot of profession with is. So 3 courses, 3 paid courses. All those courses are fee-based, and they are based on, they follow the World Bank income category, because we also provide and offer reduced prices for low-income countries. The reason is simple, is that in those regions we have specific barriers to make sure that we have healthcare workforce that are sufficiently qualified to promote and to offer diabetes education for people with diabetes. So it can be shortage of healthcare professionals, it can be a lack of standardized programs, it can be difficulty to access education, and also it can be a lack of recognition by healthcare organizations and ministries of health on the specific competencies that are required for diabetes education. And this is where our advocacy colleagues come into play by raising awareness and ask for in-depth change in society. So all courses start with an introduction on diabetes. So you can find more information absolutely on the website. And then the rest is a customized set of modules for each professional. So for primary care physicians, you will go into depth in certain areas. If you're a specialist, you will discover more things on other topics. And if same thing on a diabetes educator, you will go into understanding of different topics. And to experience this high-level training, we also have designed free short courses. So there are 3, and they are free, as the title suggests. So we have prevention of type 2 diabetes, then we have diabetic retinopathy, and we have diabetes and cardiovascular disease. So you will see that the prevention course is the most successful course on the platform. And it makes sense because up to 90% of global diabetes cases are type 2. And the number of people that are affected by this condition is increasing in almost every country. So this is the main page of the prevention of type 2 diabetes. We highly encourage you to take this course, even if normally the courses on the school are just for healthcare professionals. We think that you can really benefit from this course, and all you have to do is to sign up, so to register to the course by clicking on sign up, the blue button that you can see on the top right hand corner of the screen, and then just start the course. So to give you an idea how the course works, we will first evaluate your diabetes knowledge before everything. Then you will respond to 10 multiple questions. Then you will navigate through the module content, which includes a lot of interactive exercises and case studies. Then we'll ask again 10 multiple questions, and then we will evaluate again your diabetes knowledge after completing the course. So at this point, you should feel really shift in your confidence. And finally, before accessing to your certificate and your European credits, we'll usually ask our learners to rate the course and to give us feedback, and that helps us then to promote better and better content. And just to specify, so the certificate, you don't have to pay for the certificate itself. So for the short courses, everything is free. And for the paid courses, you just have to pay the course itself. So one course, for example, primary care physician, includes 8 modules. So you will pay for the entire course. And once you complete the course, you will have your certificate, but you don't pay specifically the certificate. So the school is not the only project that we have in our department. It's not the only project that we follow. We also have different activities, and I will have Celia presenting it. I'll let the floor to her.
Thank you, Sango. As he just said, the education team also focuses in other activities and we want to point out 3. One is the KIDS project. That it's a project in children that what we are trying to do is promote and support in the school environment for all around the world, for all kids. However, we will talk about this project in another webinar, so you will know about this in the future. Another project that we have is the IDF Centers of Education and Excellence. That is mainly an international network for healthcare professionals to always be updated and to have assured that we have a high quality education system. And as you can see now in the screen, we have DNET. DNET is a community that tries to focus diabetes professionals who are interested in improving their practice and their knowledge, and to learn from other healthcare professionals around the world, because it's always really interesting to have different perspectives while treating patients. So as you can see, we have a discussion forum, and it's really interesting. You can be updated in that, and you can follow this, because every month we have a new post about the newest developments, and we have some discussions that regard not only doctors, but also new initiatives. We also talk about nutrition, about physical activity, about different approaches between doctors and patients. So it's really interesting to read this. Another thing that we have is the library, which can be really interesting, especially if you are working in a university project and you need to do some research about something related to diabetes. You can access here and share some resources. Then there is a calendar where you can see all the events that we are doing and all the information that we are sharing regarding diabetes. And then, of course, we have the Ask DNET portal that you can get support from all our community, which is focused in over 188 countries with a lot of healthcare professionals and many people from different backgrounds in the health system. As you can see, the current discussion that we have this month is about diabetes among refugees in the Middle East. And we also wanted to point out another one that took place in February. It was how to improve the patient-doctor relationship, and it was done by 3 of the YLD members.
Thank you, Celia. I really think that those resources will help you tremendously. And finally, to close this webinar, we wanted to share with you some feedback that we received from our learners. We received plenty of positive testimonials, and this is really a motivation to create and update more content for healthcare professionals. We know that it's a long and tedious process, but we really see this as a stimulus to reduce the gaps in education, in diabetes education among professionals. And we are not the only ones doing this. As I was saying in introduction, as a YLD member, you're also participating in these activities through your individual project in your region, whether it is advocacy, education, raising awareness, and whatever the field you chose to focus on, you are doing things to make things change and to produce something different for the future. So it has been a pleasure to present to you the school today. We hope that you learned a few things and that you enjoyed this moment with us as we did. And see you soon, maybe on the school. Who knows?
Yeah.
Thank you, everyone.
Thank you.
So thanks a lot to Shango and to Celia for participating in this webinar. It was very interesting to know more about the IDF School. So I've seen during the webinar a few of questions in the chat. So basically, just to clarify, let's go together through the main points. As Shango explained, in the IDF School of Diabetes, there are 3 free courses that are available for everyone. Exactly. Those are the one on type 2 prevention, on retinopathy, and on cardiovascular disease. And then you have a lot of different paid courses, but those are only for healthcare professionals. So those of you, those YLDs or BCDs that are healthcare professionals can access to the paid courses. But for the rest of you, we really encourage you to just take the free courses. You may wonder, that's it. So you may wonder, if I have type 1, why should I be taking the course on type 2 prevention? Well, as a BCB and as a YLD, you are supposed also to advocate for better care, for better prevention of type 2 diabetes in your country, and in general for a better life for everyone with diabetes in your country. So we believe that this course can really help you better understand type 2 diabetes, and it can help you in your advocacy work in your country. So that's for the different types of courses. Also, as Shango said, you do not have to pay for the certificate. So what you pay for is for the course, in the case of the paid courses, and in the case of the free courses, everything is for free, the course and the access to the certificate.
Exactly.
One other thing that we want to ask you about is, well, you know now more about the IDF School of Diabetes, so please share the word in your country, share this information with healthcare professionals that you may know and that do not know the IDF School of Diabetes, because this information, these courses may be interesting for them. And then moving to the second thing that we have seen today in the webinar, DNET. This was created for healthcare professionals, but we encourage all of you to join because every month there will be a new discussion that you can join, and you can learn a lot about different topics that you may not think that are linked to diabetes. So, for example, the issue that diabetes poses in humanitarian settings. As Celia also said, some BCVs and some YLDs have in the past moderated discussions. So, of course, if you think about a topic that you believe is very important to discuss, and you see that there has been no discussion on the net so far on that, please contact us and let us know about this topic, and we will see if we can organize a new discussion on that. So before closing the webinar, just for everyone to know, every time that there is a new course on the IDF school or there is a new discussion on the net, we will inform you about the YLD or the BCB weekly update. So do not worry, you will always have the latest information. And remember, for the YLD trainees 2019, that this is not your last stop regarding this webinar. You need to respond to a feedback questionnaire that we are going to be sending you in a moment by email. So that's all for today. If you have any questions, please don't hesitate in contacting us at advocacy@idf.org. If you have any questions for ourselves or for Shango and Celia, we will be very happy to respond to all your doubts. Thank you.
Pleasure to respond, yes. Thank you. Thank you, Beatrice. Thank you, everyone.
Thanks a lot. Bye.